How does TACE bridge liver cancer patients to transplant? Imagine a patient waiting for a new liver while battling liver cancer. During this waiting time, their tumor might grow or spread, making them ineligible for transplant. That's where transarterial chemoembolization, or TACE, comes into play. TACE is a minimally invasive procedure that helps control the tumor and keep the patient eligible for a transplant. It works by delivering chemotherapy drugs directly into the artery feeding the tumor, which allows high concentrations of medication to reach the cancer cells. At the same time, tiny embolic agents are injected to block the blood vessels supplying the tumor. This dual approach both traps the chemotherapy inside the tumor and starves it of oxygen and nutrients, causing the tumor to shrink or stabilize. The main goal of using TACE as a bridge to transplant is to prevent the tumor from growing beyond the limits set by transplant guidelines. For example, the Milan criteria specify that a patient is eligible if they have a single tumor no larger than 5 centimeters or up to 3 tumors each no larger than 3 centimeters. If a tumor exceeds these limits, the patient might be disqualified from transplant. TACE can help reduce the size of the tumor or slow its growth, keeping the patient within these criteria. This is especially important because long waiting times for donor organs can lead to tumor progression, which might cause the patient to lose their transplant eligibility. Another key benefit of TACE is its ability to target tumors selectively. Since liver tumors mainly receive their blood supply from the hepatic artery, TACE focuses on these vessels, sparing most of the healthy liver tissue. This is crucial for patients with underlying liver disease, as preserving liver function is vital for their overall health and success after transplant. Patients considered suitable for TACE usually have good liver function, no significant portal vein thrombosis, and no spread outside the liver. It is often used when surgery or other local treatments are not possible or as a preparatory step before transplant. Clinical guidelines recommend TACE for intermediate-stage liver cancer and as a bridging therapy. Studies show that TACE can lead to partial tumor responses or keep the disease stable in many patients, increasing the chances of successful transplantation later on. Doctors often repeat TACE treatments at intervals to maintain control over the tumor while waiting for a donor. The procedure is tailored to each patient, considering tumor size, number, liver health, and overall condition. In summary, TACE helps bridge liver cancer patients to transplant by controlling tumor growth, preventing disease progression, and maintaining liver function during the wait. This approach can improve the chances of a successful transplant and potentially lead to a cure. Always remember, individual cases vary, so it's essential to work closely with a healthcare team experienced in liver cancer and transplantation to determine the best plan.